Hello friends, myself Dr. Ruchika Garg from Agra. Today I will be telling you about high blood pressure during pregnancy and how it affects your fetus and yourself. So high blood pressure is found in many women, around 6 to 8% of pregnancies, and it has a detrimental effect on both the mother and breathless fetus, and in severe cases it might even cause maternal death also. So how is blood pressure diagnosed? So generally if it is more than 140 by 90 millimeters of mercury, systolic more than 140, diastolic more than 90 after 20 weeks of pregnancy and associated with proteinuria, and when you do a urine protein examination there is presence of proteins, and this blood pressure should be on 2 occasions 6 hours apart, high blood pressure. So we will call it as pregnancy induced hypertension. Sometimes it might be a chronic hypertension, that is a patient with hypertension, she gets conceived and then she will develop high blood pressure during the pregnancy. So what are the causes of high blood pressure during pregnancy? So some women who are obese, who are overweight, or those who have a family history of hypertension, or who have a previous history of hypertension in their pregnancy, there are more chance of developing hypertension during this pregnancy also. And twin pregnancies, multiple pregnancies, they have high chances of hypertension. Some other autoimmune conditions and inherited genetic disorders, they might also cause hypertension during pregnancy. So why are we worried about hypertension? Because it can cause so many symptoms to the mother. There is too much of edema or weight gain in such women, there is tightness of rings and swelling in the whole body, first of all in the legs. In severe cases whole body is swollen, or the abdomen and that belly is also swollen. So if you press the finger you can feel the depression over there. So normal some amount of swelling is normal during pregnancy, but if it is severe along with high blood pressure, so along with proteinuria, presence of protein in the urine, so how can you treat it, and why are we worried? Because it can cause growth restriction in the baby, IUGR, and preterm delivery might be required, because it is a placental condition. There is uteroplacental insufficiency, blood flow to the fetus is reduced because of the vessels are constricted, so blood flow and oxygen, the fetus is not getting proper oxygen. So the liquor, the amount of water, it might also be reduced, and these patients may also get placental abruption, that is vaginal bleeding during pregnancy, dark colored bleeding, and even intrauterine death of the fetus is possible. After delivery there may be hemorrhage, severe bleeding going on, and the patients may also develop convulsions or coma. That is a very severe condition. This can also cause HELLP syndrome or low platelets, and coagulation abnormalities may be there, that is failure of stopping of bleeding, because this high blood pressure can affect both the kidneys as well as the liver. It can cause kidney failure and liver failure, and in severe cases cerebral in the brain hemorrhage and brain convulsions and coma, fits. So we have to take the risk benefit analysis, because once you deliver the baby, many times it happens that the blood pressure comes to normal after delivery. So we have to see whether continuation of pregnancy is causing harm to the mother and the fetus. So we might have to deliver it by in early weeks also, because once we deliver the baby, the hypertension, we can reduce the risk to the mother. In such cases cesarean section rates is also increased, because the doctor will see if your cervix is dilated, then only they can take you for a normal vaginal delivery trial. Otherwise pregnancy termination is required immediately in cases of severe hypertension. In that case cesarean might be required. It will reduce the stress on both the mother as well as the fetus, because then the fetus can also be can also survive. So you need regular blood pressure monitoring, so it is, and ultrasound for fetal growth, and the amount of liquor, because in such cases the fetal growth might also be reduced, and regular blood pressure checking, and it might also require hospitalization. Because blood pressure monitoring requires hospitalization, the doctor will see whether oral drugs can control your blood pressure or not. If not, the dose of the has to be changed, and whether she has to be taken on injectables, and anemia that needs to be corrected, because these patients cannot tolerate severe bleeding and coagulation abnormalities they might occur. So treatment is available, but you need to be careful, and frequent visits are required, because it generally develops during the later half of the pregnancy, and such women also have a chance of developing hypertension in their next pregnancy, and they may remain chronic hypertensive also. And so blood pressure, but many times it comes to normal immediately after delivery or within few hours of delivery, and so it may also leads to preterm delivery, because to salvage the mother, to save the mother, we might have to terminate the pregnancy by either artificially inducing the pains or by cesarean section. By giving, the doctor will give you steroids for maturing the lungs of the fetus, and because before 37 weeks of pregnancy we take it as a preterm delivery, but the fetus can be saved after generally 34 weeks. By that time the lungs usually mature, and nowadays many therapies are available, surfactants and all, they will cause the lungs to mature. So sometimes even heart failure and pulmonary edema, lung failure can also occur because of severe hypertension. So the doctor will give you proper medications. So that shows the importance of proper antenatal care during pregnancy. Bye bye.